How are you? This is Pom, and welcome back to the channel Safety with Pom. As temperature rise, so do the risk associated with working in hot environments. So heat-related illness can strike very fast and without warning, as you know that they can attack us without any warning also. But the good news is, heat-related illness is preventable. And in this video, we will walk you through the dangers of heat stress, how you can recognize them, and the warning signs, and the most importantly, how to stay safe when the heat is on, whether you are on the factory floor, at a construction site, or working outdoors. And the this training could save your lives also. Okay, so let's dive in and learn how to beat the heat before it beats us. So before starting this training, I would like to request that please do not forget to subscribe the channel and like the video if you haven't subscribed the channel. And please do share the video also with others so it could be beneficial for them as well. And let's start the training. So first of all, before starting this training, I would like to show this OSHA data as well. As you know that is into work, nearly 3 out of 4 fatalities from heat illness happen during the first week of work. So build a tolerance to heat by increasing intensity by 20% each day. So there is a campaign by the OSHA also prevent heat related illness at work. So they have given the different what you call suggestions to avoid the heat illness or beat the heat. So these are the suggestions that we can use as per the OSHA guidelines as well. And heat-related illness are very dangerous. They can cause death also, and it is very important to identify them before they cause any risk to our workers and our employees. So thank you for watching. So let's start this video. Please comment, subscribe, share, and like the video. So what is the learning objective by this training? By this training, you will be able to identify who is at risk of heat-related illness, the causes of heat-related illness, and the what factors contribute to heat-related illness. The consequences, what are the consequences? Symptoms, treatment of heat-related illness, NMDC heat stress campaign provisions, heat index guidance, flag systems, and site arrangements. So all of these things we will learn through this training. So let's start with the introduction. The introduction, first of all, for the heat-related illness. So heat stress occurs when the body cannot cool itself enough to maintain a healthy temperature. As you know that whenever our body temperature will increase, we start to sweat, and that way body will maintain our temperature. But in certain cases, when the heat related illness will occur, our body will not be able to remove that much of temperature from the body through the sweating. Then the heat related illness will start it, and that can cause any risk related to the illness also. So normally the body cools itself by sweating, okay, but sometimes sweating isn't enough and the body temperature keeps rising. It will go up and up. So heat related illness can range from a mild condition such as rash or cramps to very serious conditions such as heat stroke, which can kill us also. So heat related illness could be mild also, and it could be very serious also, that can cause death also. So first of all, we have to identify that who is at risk of heat related illness. So anyone is at risk from the heat related illness who can suffer from heat related illness, but there are some people who is at most risk, okay, other than the common victims, over age people, okay, then the babies, young children, pregnant and nursing mothers. These are the key people who is at most risk of heat related illness. Okay, so you have to be very careful with these people. The people are walking under the sun who are physically unwell, and especially with heart disease, high blood pressure or lung disease may have high chances of suffering from heat illness. So these people are also under the risk of heat related illness. So if you are encountered with these people, or if you are working with these people, you have to be very careful. You have to make sure that you are taking all the precautions before you are assigning any task them to in the hot environment. So first of all, as an employee, as a worker, you have to check that are you hydrated enough. Okay. So how you can check that? You can check that through the urine color chart also. Okay. If this color is there, if your urine, then you are hydrated. If this is the color of your urine from 4 to 8, then you are dehydrated. Then you must drink plenty of water. 1 to 3 is okay, but 1 is best. Then the causes. The common causes of heat stress are overexertion in hot weather, sun or bushfire exposure, and exercising or working in hot, poorly ventilated area, confined areas can increase your risk of heat stress. So these are the common causes of heat related illness which can increase your body temperature. So heat can also make an existing medical conditions worse. For example, heart disease. If you already have a medical condition, heart related illness, and if you are working in a hot environment, then that condition will make your physical your medical what you call illness will it will make more worse. So that also you have to take care. So when it is hot, hydrate, hydrate, hydrate. So hydration is very, very important to make yourself hydrate. It is very, very important to beat the heat. So that you have to teach to your employee and the workers. So what factors contribute to the heat related illness? So that also we have to identify. So there are many factors which can cause heat stress and heat related illness. It's included excessive sweat loss. If you are losing the excessive sweat from the body, so what will happen? Body will start to dehydrate and body temperature will rise. Then your temperature will increase. The normal body temperature of the human being is 37 degrees Celsius. So the body, it will cool itself by releasing the sweat from the body, which is normally accounts for 70 to 80% of the body heat loss. So 70 to 80% of body heat that will be lost by the sweating. So if a person excessively sweat, loss their body temperature keeps rising. So if you are losing excessive sweating, so what will happen? Your body temperature will keep rising. So lack of airflow also. If you are working in hot environment, but the airflow is very poor, ventilation is very poor, then what will happen? Your body temperature will increase, more sweating, then more temperature will increase your body. Then sun exposure. If you are exposing to sun, especially on hot days between 11 a.m. to 3 p.m., then you are overexposure to the sun, then more sweating, then more temperature will increase of your body. Okay, so that's why I'm in UAE. So as per the UAE rules and regulations, okay, it is a law that after 15th June, okay, 15th June, 15th June to 15th September, between 12 to okay 12 to 3 p.m. workers are not allowed to work outside. It is the law in UAE. So same like what you can do is same in this way you can put a work what you call work stop or midday break during the summer season in your countries in your areas, that during this time to this time the workers are not allowed to work outside direct exposing to sun. So hot and crowded places also will contribute to the heat related illness. It will increase the body temperature because the reason is in these conditions there won't be any airflow and the temperature will be very very high and you will not get the proper air circulations. Then in this way your body temperature will rise. Then the bushfire exposure to radiant heat from bushfire can cause rapid dehydration and heat related illness also. Okay, so bushfires usually occur when the temperature is high, which adds to the risk. So that is this is the another reason. Now what are the consequences of this heat related illness? Excessive sweat loss result in dehydration. The body temperature will keep rising. You will dehydrate because you are sweating too much, but the water is not going in that way inside your body. The body lost its ability to cool. Then the body function will stop. Body has a function to cool down the body temperature itself, but that system will collapse. Then increased blood flow to skin cause decrease in organ function. Then the blood flow will stop or it will reduce. Then what will happen? Organ will not function as required. So that is the consequences due to the heat related illness. Then what are the symptoms? Now you have to identify the symptoms. Very, very important. Now you know the consequences. Now you have to identify the symptoms to the staff also, whether they are exposed to the sun or not, whether they are going through the heat-related illness or not. It is very important. You have to identify the symptoms. So it is important to know the signs and symptoms of heat exposure and how you should respond symptoms vary according to the type of heat related illness. Okay. So some heat related illness and common symptoms, it is including weakening in existing medical conditions. Okay. So if they have existing medical condition, that will get more weaker and weaker. So briefed in the following slides. So this is the most common health problem of heat stress. So heat rash. First, we have the heat rash. So you can see here, this is the symptoms of heat rash on the skin. So sometimes we are calling it the prickly heat. So this is a heat skin irritation caused by excessive sweating. When the body excessively sweat, so that will happen. Heat rash will happen. Sorry. So it is most likely to occur on the neck and upper chest. So especially on the neck, especially on the back side and upper chest, it is commonly occur over there. Then we have the heat cramps. Heat cramps, these include muscle pains, okay, heat cramps. So simply normal cramps like that. So these includes in the muscle pain or spasm, usually in the abdomen, arms or legs in heat cramps. So they may occur after strenuous activity in a hot environment when the body gets depleted of salt and water. Okay, and they may also be a symptoms of heat exhaustion. So these are the symptoms of heat rash and heat cramps. So now let's move to the dizziness and fainting. So heat related illness, the further after the heat cramps and heat rashes, the next stage is dizziness and fainting. So results from reduced blood flow to the brain. So whenever there is a blood flow is getting less or it going very, very slow to the brain, so what will happen? Dizziness and fainting will occur. So the heat causes an increase in blood flow to the skin, pooling of blood in the legs, which can lead to the sudden drop in blood pressure. So too much of blood will be pulled by in the legs and the skin also, and the sudden blood pressure will go down. So there can be a feeling of light headache before fainting occurs. So these are the symptoms of dizziness and fainting. Next, we have the heat exhaustion. So this is a serious condition. After the dizziness, the next stage is heat exhaustion, and it is one of the serious conditions. So it can develop into heat stroke as well. Okay, so it occurs when excessive sweating in the hot environment, like construction workers, they are working direct under the sun, and in that environment, what will happen? They will excessively lose the what you call body externally, they will start to sweating, so the body water will lose through the sweating. So in that environment, what will happen? In that hot environment, the blood volume will reduce. The symptom signs may include like the paleness and the sweating, rapid heart rate will go high, very, very high, muscle cramps, okay, headache, nausea, vomiting, dizziness or fainting. All these uh, things which I inform you, heat rash, heat cramps, dizziness, and fainting, all these things will occur here in heat exhaustion. If you are in these conditions, then it will occur here. Okay. Then we have the heat stroke, the very, very dangerous one. After the heat exhaustion, then we have the heat stroke. So this is a medical emergency. If anyone has a heat stroke, you have to call the ambulance immediately, and it required the urgent heat stroke attention. Okay. So heat stroke occurs when the core body temperature is raised 40.5 degrees Celsius. So normal body temperature, as you know that it is 37 degrees Celsius, and when the body temperature will rise 40.5 degrees Celsius, then it's called heat stroke. And the body internal system will start to shut down. The internal body system that it will stop, it will not function. Many organs in the body it will suffer, and they may damage also. The body temperature must be reduced quickly, otherwise person will die if you will not reduce the body temperature. It's affect central nervous system, and that is very, very dangerous. The person may stagger, appear confused, have a fit or collapse, okay, in this situation, and the person can become unconscious also, as well as effects on the nervous system. It will affect on the person nervous system. There can be after then liver, kidney, muscle, and heart will damage also. The symptoms of heat stroke may be the same as for the heat exhaustion, but the skin may be dry with no sweating. In heat stroke, there won't be any sweating, okay, and the skin will be dry. But compared to heat exhaustion, there will be heat. There will be like sweating, and the skin will not dry. There will be sweating. The skin will be wet. Okay, and it will affect the person's mental conditions also. So that is the heat stroke. So these are the uh, illness which can cause by the heat, hot environment if the person will work. So there are two: heat stress, heat rash, and heat cramps. Then we have the dizziness and fainting, heat exhaustion, four, then heat stroke. So total five types of illness we have due to the heat related illness. So these things you can keep in mind during the interview also, okay, and during the NEBOSH training also, whether it is IGC diploma or during another type of health and safety exam also. At that time, you might get these type of questions. Even in the CSP also, okay, ASP also, these type of questions will come regarding the heat related illness, and it is very important to protect your worker from the heat related illness by knowing the symptoms. Heat stroke, the symptoms I already inform you. Okay, this is the poster that we can use for the heat related illness. The prevention also could be there that we will discuss in the later. Now, the treatment for the heat related illness, how we can treat the heat related illness. Treatment options vary according to the type of heat related illness. First of all, you have to identify what kind of heat related illness person is suffering from. First, heat cramps, heat rash, okay, dizziness or fainting, heat exhaustion, or heat stroke. So you have to identify. Only then you can provide the care. Now the treatment for heat related illness, heat rash, the first one. Let's start with the heat rash. So treatment for heat rash, it is including move the person to the cooler environment, less humid environment. Okay, the temperature should be below 25 degrees Celsius. Then the keep the affected area dry. If the person affected area is chest, mouth, or face, so that area should be dry. Try using unperfumed talcum powder to increase comfort. Use the powder, talcum powder. That should not be perfumed one, okay, without scented. And avoid using ointments or creams. Do not provide any creams because they keep the skin warm and moist and may make the condition worse. Once you will put the cream or ointment on the skin, what will happen? The pores where the skin is sweating, you will close those pores. Then what will happen? Body will not able to remove the sweating, remove the temperature from the body. Then the body temperature will more increase. Then you will worse the conditions. Okay, so avoid that thing. Heat stress, protect yourself. Heat stress awareness also, and beat the heat campaign also that you can use in your work environment. And it is very important. And I would suggest you beat the heat and heat stress awareness campaign also that you can provide in your work environment. And do not forget to start nowadays. Now the treatment to heat related illness. Now the next one we have the heat cramps treatment. Treatment for heat cramps, it is include stop activity. Okay, stop the person to do any activity. Ask person to sit in a cool place. Increase fluid intake. Give the water mainly with the salt. Okay, ORS that we are saying. Okay, then the rest a few hours before returning to activity, and seek medical condition if the person is having some problem. Then the next we have the treatment for the dizziness and fainting. Treatment for dizziness for fainting, it is including get the person to cool area and lay them down. If fully conscious, increase fluid intake. Okay, all of these three type of what you call these treatment. You seen that we have to move the person to the cool area. So that is the number one requirement. So make sure that where the person is working in hot environment, you must have a cool area where if the person is getting any heat related illness, then you can easily transfer to that area. So that is the number one requirement. And the air also and the water. The next one we have the heat exhaustion treatment. So treatment for the heat exhaustion, it is include get the person to a cool area again, okay, and lay them down. Then remove outer clothing to get to make sure that body temperature will cool down very fast. Wet skin with cool water or wet clothes that you can use it like this, okay, and increase fluid intake if they are fully conscious and seek medical advice. So all of these treatment you have seen that cool area, number one requirement, okay, then fluid intake, it is very very important. These are the two major things that you must have in your work area. Now the next one we have the treatment for the heat stroke. So heat stroke, as I told you that it is a medical emergency and it requires attention. Call for emergency support, okay, get the person to a cool area, shady area, and lay them down. You are waiting for the emergency medical help. Then remove clothing and the wet their skin with water, fanning continuously. As you know that in these conditions, heat stroke, their skin will be dry, so you have to make sure that their skin is wet. So you have to use the cloth with the water. Do not give the person fluids to drink. So do not give any fluids to drink them. And position an unconscious person on their side to clear their airway. Okay, so they should not keep like this. They should uh, keep on the side, so their airway should be clear. ABC position, you know that if you have gone through the first basic first aid training, so that we have to use. If medical attention is delayed, seek further instructions from the ambulance or hospital emergency staff. So these are the treatment that you have to use if the person is unconscious in heat stroke. Okay, it is very very important. Now let's go to the difference between the heat exhaustion and the heat stroke. As you know that heat stroke is more dangerous. Okay, in heat exhaustion, faint or dizziness will be there, throbbing headache in heat stroke, excessive sweating, no sweating in heat stroke, cool, clammy skin, red, hot and dry skin, nausea or vomiting, same, rapid weak pulse, rapid strong pulse. Pulse will increase in the heat stroke. Okay, muscle cramps, maybe lose consciousness. Okay, so these were the symptoms and these were the treatment for the heat related illness. Now let's move to the OSHA Heat National Emphasize Program. So the OSHA has a program for the heat related illness also. So the OSHA goal of this national emphasis program is to reduce or eliminate worker exposure to heat related illness, hazard, okay, injuries, and that's by targeting industries and the work sites, including work sites with the radiant heat sources where employees are exposed to heat related hazards and have not been provided adequate protection that includes cool water, rest areas, training, and acclimatizations. So that is a program was run by the OSHA. So let's go through this program. So as per the OSHA, heat-related inspection is required, okay, to increase the likelihood of preventing heat-related illness. OSHA that's and make efficient use of OSHA resources. The compliance, safety, and health officers, okay, who are investigating for further purpose shall open or refer a heat-related inspection form. So they will, OSHA officer, they will do the inspection. Then any hazardous heat conditions observed you recovered in the OSHA 300 log incident reports, or where an employee brings a heat related hazards to the attention to the officer, okay, such as employees being exposed to high temperature conditions without adequate training or acclimatizations or access for water, rest and shade. So in these conditions, there will be an inspection from the OSHA side. If any report is received from the worker side and if there is a likelihood, OSHA officers observe there is a likelihood of heat-related illness, then they will come for the inspection. Now, the OSHA officer should inquire during inspections regarding the existence of heat-related hazard prevention program. So, what kind of heat-related program you have that can avoid the heat-related illness? Okay, that will be asked by the OSHA officer. A heat priority day occurs when the heat index for the day is expected to be 80 degree Fahrenheit or more. Furthermore, the program inspections shall occur on any day that the new NWS has announced a heat warning or advisory for the local area. It is the requirement by the OSHA. Then the inspection, how they will do the inspection. So the inspection content, it is one of six. Okay, first review. They will review the OSHA log 300 and 301 for the incident report for any entries indicating related to a heat-related illness. Then review or any records of heat-related emergency room visits or anything like that. Then they will interview the workers. So symptoms of headache, dizziness, fainting, dehydration, and other things. They will do the interview. After that, they determine if the employer has a heat-related and injury program addressing heat exposure and consider the following. Then they will check the program whether the employee has a heat-related program or not. And if there is any written program, they will check how did the employer monitor the heat-related illness, and was there unlimited cool water on the site or not. Did the employer require additional breaks or hydration? Were the were there scheduled rest breaks or not, which is provided to the employee. So all these things will be checked. Now they will determine if the employer has a heat-related illness in program. So in this program, was there access to the shaded area by the worker? Did the employer provide time for acclimatization for new and returning workers? Was a buddy system in place on hot days or not? Were administrative controls used, earlier start times and employee job rotation to limit heat exposure? That will be checked. And did the employer provide training on heat related illness, signs, how to report signs and symptoms, how to identify first aid, how to conduct emergency personnel prevention, and importance of hydration? All these things will be checked. Then the inspection document condition relevant to the heat related hazards. It is including the heat index, additional weather data from the day, okay, which is released by the OSHA. So those documents will be checked. Additional information may be needed for or indoor heat investigation. That also will be checked if the indoor heat temperature is managed or not. So the document condition relevant to the heat-related illness or the hazard, it will be like observe the document current conditions, if they are updated or not. Observe wind speed, relative humidity should be there in the document. Dry bulb temperature at the workplace in the shaded rest area, which is very, very important. And wet bulb globe temperature at the workplace. Then cloud cover. Then the existence of any heat advisory warnings or alerts the previous day. So these things should be there in the documentation. Now the inspection content, 6 of 6. So identify activities relevant to heat related hazard. These can but are not limited to potential source of heat related illness. So that need to be identified and need to be included in your heat related program. Okay, the use of heavy or bulky clothing or equipment, including personal protective equipment. Estimate workload, okay, extraction by observing the type of job task performed by employees and whether those activities can be categorized as moderate, heavy, or very heavy task. So as per the worker doing the task, those tasks need to be prioritized also. The more heavy the work is, the more they will lose the joint. Okay. So as per that heavy task, you have to give the break to the worker. Then who is affected, you have to categorize in your heat related illness program. Okay. So there are workers who is mainly affected. There are outdoors and indoors. Outdoors we have the agriculture, construction, roofing workers, landscaping workers, mail and package delivery, oil and gas, well operations. Then we have the indoors, bakeries, kitchens and laundries, electrical utilities, fire services, iron and steel mills and foundries, manufacturing and warehouse. So indoors and outdoors, both the activities you have to check because both the activities can cause heat related illness. Now, what do we need to do now after that? Program requirements. Define leadership and responsibilities. Okay, who will do what? As per your same like HSC plan. So you should have the heat related illness treatment plan. So in that one, you have to decide who will do what. Assess the heat hazard and risk assessment required. Then create and implement a plan to mitigate and respond hazards, and you have to provide training. And day-to-day supervision is very, very important. Now, define the leadership and responsibility. Who is responsible for assessing the heat hazard that you have to check? and who is responsible to make sure that the hazards have been addressed, who is responsible to make sure employees have training. Then define leadership and responsibility, who is responsible to make sure the hydration is available. So in that way, you have to make sure that you are defining the roles and responsibility in the heat stress related illness campaign or the program. Second thing, assess the heat hazard and the risk. So there are different ways you can assess the heat related hazards and the risk, and there are different utilities and tools are there. Heat safety tool user guide also is there, which is certified by OSHA and NIOSH, so that you can use. And there is a wet bulb globe temperature also that you can use. It will measure the heat stress in direct sunlight, which takes into account temperature, humidity, wind speed, sun angle, and cloud cover. So these things you can use. Then factors to consider: air temperature that you have to consider, then humidity, radiant heat from sunlight or artificial heat source, air movement, convective, and acclimatizations. These things you have to consider. Now, what is acclimatization? Now, let's move to the acclimatization, which is very, very important to the new worker or returning worker before they put into the work in the hot environment. Then acclimatization is very, very important. 50 to 70% of outdoor fatalities it is occur because in the first few days of working in warm or hot environments, because the person who's working in the outdoor hot environments, their body is not acclimatized, their bodies are not ready to take the risk. Then the process of building to tolerance is called heat acclimatizations. So it is the process where the body will tolerate to take the heat. Lack of acclimatization represents a major risk factor for fatal outcomes. Now the simplified heat exposure recommendations. So effective wet bulb globe temperature, if it is below 70 Fahrenheit, 21 degrees Celsius, then low risk of heat related illness. So low risk of heat related illness. So acclimatized worker, they have the low risk. 70 to 77 degrees Celsius, Fahrenheit, 21 to 25 degrees Celsius, then the strenuous work possible, low risk of heat related illnesses still. If it is more than 25 degrees Celsius, then high risk of heat related illness with strenuous work, then the possibility unsafe. It is possibly unsafe. So acclimatization is very, very important if it is more than 25 degrees Celsius. Now, acclimatization, you have to consider some factors. So air temperature, conductive and radiant, okay, humidity and evaporative, radiant heat from sunlight or direct or indirect, air movement, then acclimatization and physical activity. These things you have to consider. Now, additional factors you have to consider, like the clothing, what kind of clothing you are giving to the worker, okay, ability to rest, hydration and ability to hydrate, airflow, pre-existing health problems, age, obesity, medical conditions, all these things you have to consider. Surface and environment, availability of shaded or cooling area, heat from equipment or process, how much heat is getting removed by the equipment. That also heat also you have to check. Significant temperature changes, thermal shock, all these things that you have to check. Now, OSHA has a heat stress calculator. If you will go to the OSHA website, then you will type OSHA heat stress calculator. Then you will get this calculator, and this calculator you can use to calculate the heat stress. Okay, so in this way you have to put the wet bulb globe temperature. What is the temperature has? Workload is it moderate, high, or low? Acclimatization status, whether it is acclimatized or unacclimatized. Clothing, double layer of clothing or single layer. What is the body weight? It is the normal body weight or high body weight. So once you will put it, then you have to submit. Then the result will come, heat stress is above limits. Okay, now this one. The result of this one is this. So you can use this one also. It is very good. Now create and implement a plan. The third step. Who is responsible? Okay, what activities they will do, where, location, when, the time, the day or night, and how, addressing heat hazards. Create a implement plan, hydration break. Okay, plan who, where, and when. Then the bathroom facilities, location, cleanliness, where it is, Everyone should be aware about it. Emergencies, what is the number, what they have to do during the emergency, whom they need to contact. All these information should be there. Then at the last not the least, the employee training is very important. Adaptable plan for hydration and facilities. Where is your hydration source that you have to aware about it. A portable, who is keeping it stocked? Is it accessible for all employees or not? Who is monitoring employee status? And what restroom facilities are available at site? So that also need to be considered. Now, providing the training is very important to make sure that the employees and the workers, they are aware about the heat-related illness. They know how to identify the symptoms and they know the treatment as well. So, conduct training prior to commencing work. Conduct training at the work site and areas. Ensure employees are familiar with the hazards related to the heat illness and ensure employees are familiar with the plan. So, these training need to be provided. So ensure employees are aware of the location, hydration facilities, employee expectations, reporting of unsafe conditions, where they need to report, whom they need to report, and emergency situations where they have to report it. All these things need to be trained. Then there is a day-to-day supervision, which is very important as per supervision. Who is monitoring the temperature, humidity, and conditions of the worker? Who is responsible for making sure the hydration facilities are accessible, clean, and adequate? It is the supervisor responsibility. Then the who makes sure the plan is being followed. Then who is responsible for changing the plan if condition warrant? Okay, and who will evaluate the success of the plan? So all these things you have to take care, and you have to make sure that each and everyone is being monitored and checked. There is a one system, we are calling it flag system. So flag system is a scheme where we use the different color coded flags, and it shall be implemented to indicate the level of heat stress condition on a given day. So this flag system also you can use in your work area. It is very beneficial, and it will help you to fight with the heat related illness. So flags corresponding with the color code in table 1, I'll show you the next, shall be installed at several prominent locations throughout the site to keep personnel informed of the heat stress conditions for the day that can be used. And the purpose of the system is to anticipate high heat days through weather forecast and to communicate heat conditions using color coded flags. So we have the white color, we have the green, yellow, red, and black. So less than 80 degree Fahrenheit, white color you have to use, extremely intense physical extraction at less risk. Then 80 to 84.9, green color, 85 to 87.9, okay, yellow color, then 88 to 89.9, then 90 and above you have to use the black color, okay. So if you will come down, risk will increase. The black color one is the high risk one. Now the site arrangements is very important to tackle with the heat related illness, to fight with the heat related illness. So adequate provision of water or coolers and water supply at all times should be there. Promote the concept of drink half liter of water every half an hour. It is very important. Then ensure maintenance of the water system is carried out regularly, including the electrical system. Proper access to water cooler is provided to prevent crowding, and provision of adequate sleep hazards warning signs should be there around the water cooler, and provision of thermocoolers at various locations at site with assigned worker responsible for water replenishment. So there could be another way you can provide the hydration solution to compensate for the loss of sodium through the sweating. And midday break also, as per the UALO2 strictly followed, as I told you that we have the midday break that we have to follow. Then after then provision of frequent rest breaks to workers in line with the nature of work and weather conditions, particularly during Ramadan. Job rotation among workers is to be considered. Heat stress safety to be part of daily toolbox talks. You can daily inform to the person, to the employees during the summer season. Adequate supervision, which is very important as per the size of the workforce. Supervisor must regularly monitor the physical conditions of the workers, okay, and provision of appropriate shade for workers, educate equipped with the air conditioning units and pedestal fans as appropriate. So these are the site arrangements required, which is very important. So that's all from my side for this training. I hope you like this video and the information which I provide you, and I hope this information will definitely help you to save the workers from the heat. And I would suggest you to include heat related illness in your daily toolbox TBT to the workers, and if it is possible, do a campaign on the heat related illness, and or you can say that let's beat the heat. Your campaign title could be there, okay. And that's all from my side. So see you in the next video, and thank you for your support.